The beauty scientists, Dr. Christy Hamilton and Dr. Roy Kim. Real beauty without the hype.
Yeah, so I was fortunate. I was in Korea for about almost 2 weeks, and I asked a friend, hey, before I get there, what skincare clinic would you recommend? So I went to a skincare clinic that's run and dominated by dermatologists. It is not, I guess, a typical skincare clinic that you see on social media. So I met with a dermatologist, and the same dermatologist actually gave me all the treatments. I think what you see on TikTok or social media is, yes, there's some skincare place that is run by dermatologists, but you will meet with a patient coordinator who could be anybody, well, like literally anybody, and probably not a doctor or nurse. They'll go over treatment options for you. Then you'll meet with the dermatologist who'll confirm it or not. Then you go, if you need 2 treatments or 4 treatments, whatever, you will have that done by a doctor, but not necessarily the dermatologist that saw you, and not even necessarily done by a dermatologist. A lot of times it's done by a doctor that is moonlighting or doing this as a side gig. And so that was my personal experience getting my treatments. I had a consultation with a derm, and there you go.
So it's just like the United States, you have to know who you're going to see, because just like here, you may not be with a board certified or even a certified individual.
That's 100% correct. Yeah.
Okay. Was this like what I see online where it's like this like row of clinics like all on one street, or were you in a different part of town?
I was on a side street of that part of town. So that part of town is near Gangnam. Gangnam is a neighborhood, and it is, I mean, there's wall to wall, building after building after building of plastic surgery skincare centers. If you look up, all the signs are plastic surgery, beauty, dermatology, skincare, blah, blah, blah. So yeah, it was there.
Amazing. So you were telling me about this before we were filming, but so the first thing they do is do a thorough assessment. Is that correct? Of your skin?
Yes. Yeah.
Okay.
So I met with the dermatologist, of course. Some places, they love the technology, like you'll stick your face into a face scanner and they'll show you the massive amount of damage and ugliness that you have. And the dermatologist looked at me and did do some magnifying lens stuff and diagnosed me. And then that's when we decided on the treatments.
And what were your top concerns that you wanted to focus on, or what he wanted to focus on?
Main concerns were my age spots, also known as seborrheic keratoses for other derms out there. I also wanted better looking, more youthful skin. And finally, I wanted to ask about tighter neck skin, because my neck skin's getting loose. And so those are the 3 areas of concern. And the 4th area of concern, which was just fun, was I wanted the salmon skin DNA booster if he thought I needed it. And yes.
He didn't think you needed it?
No, he did not. He said I have pretty good skin tone, and he would not recommend any skin booster. He did recommend like glass skin or Botox facial, which is like lots of Botox injections injected just underneath the epidermis. To non-plastic surgeons, it looked like a blister, but to us, we're trying to generate a bleb. And that's what he recommended.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.